for African American men who have greater amounts of socioeconomic resources, so greater education and greater income, when they're faced with more discrimination, they have greater odds of depression than even poorer African Americans. So that's the primary finding. So as education and income went up and racial discrimination increased, greater odds of depression for African American men. We have this term called cost of upward mobility. So it's the idea that African Americans who heavily invest in themselves through social capital investments, so going to school and working in high occupational prestige settings, are actually more likely to be exposed to racial discrimination because they are more mobile. So they're living in more integrated neighborhoods, they're working in more integrated settings. And so it's possible that they're perhaps more exposed to racial discrimination than people who have less income and less education. So that's one reason why we think that there could be something going on there, just boundary crossing. The next step is to look at mobility trajectories. So I'm very interested in seeing how people move from whether they're poor when they're children and then becoming maybe middle class as an adult, or if they're middle class as a child and then moving down, seeing how those different mobility trajectories work across race. So I have a number of papers in the pipeline that will test that out and try to figure out what exactly is going on. Is it the trajectory? So one of the limitations of this study is that I only looked at cross-sectional data. And so in the future, I'll be able to see, using longitudinal data sets, how trajectories can also affect health as well.